Welcome to The Explainer. So today we're going to break down asthma, what a severe attack actually looks like, how it's diagnosed in this day and age, and most importantly, the crucial steps that can prevent a crisis from happening in the first place. Okay, let's dive right in. So how do doctors know how bad an asthma attack really is? It's all about these key differences you see here. Notice how it escalates. In a moderate attack, someone can still speak in full sentences. But when it becomes severe, they can't even finish a sentence. But look at this last column. Under key signs for a life-threatening attack, you see this term silent chest. And that is absolutely terrifying. It means the airways are so tight, there's not even enough air moving to make a wheezing sound. That, plus oxygen levels dropping dangerously low, well, that's a sign of extreme, extreme danger. So you can see the stakes are incredibly high, which really begs the question, how do doctors know for sure it's asthma in the first place? Getting that initial diagnosis right is absolutely crucial. And thankfully, the way we do that has really evolved. Right, so we're moving into the new science of diagnosis. And this is all about getting beyond just, listening for a wheeze with a stethoscope. We're talking about replacing that guesswork with hard, objective data to get a really definitive answer. And here it is, the modern diagnostic pathway for adults. It's a really logical, step-by-step process. The whole idea is to make it as simple as possible for the patient. You start with the easiest, least invasive tests first, and you're basically looking for those telltale signs of inflammation that just scream asthma. Now, this first step is actually pretty cool. It's a test called a phenotest, and you can think of it like a breathalyzer, but for airway inflammation. Seriously, you just breathe into this little device, and it gives a direct reading of a key marker for inflammation. It helps lock in the diagnosis, no needles, no complex procedures. And this next test, the BDR, really gets to the heart of what asthma is. See, the key thing about asthma is that the airway narrowing is reversible. This test proves it. You check lung function, use a reliever inhaler, and then check again. If there's a big improvement, well, that's a classic sign of asthma. It shows the airways aren't permanently blocked, they can be opened up with the right medicine. Okay, so we've got the diagnosis down. But what happens when an actual attack hits? Well, the response is just as structured as the diagnosis. It's a step-by-step approach that ramps up depending on how severe things are getting. Okay, for a moderate attack, the first goal is simple. Open up those airways and fast. That means a reliever inhaler, something like salbutamol. And using a spacer is key to getting the medicine where it needs to go. If that's not cutting it, then doctors might bring in oral steroids to really tackle the inflammation that's causing the problem. But when things get severe, everything changes. The response escalates, and it escalates immediately. Now, oxygen is absolutely critical to keep those blood saturation levels safe. You're using high doses of the reliever, and at this point, you are seriously thinking about a trip to the hospital if there's no quick improvement. And then there's a life-threatening attack. Here, there's zero hesitation. This is a 999 emergency, no question about it. The treatment gets way more aggressive. We're talking high-flow oxygen, a nebulizer blasting, and a cocktail of drugs to open the airways, and steroids delivered straight into the vein for the fastest possible effect. Literally, every single second counts. With all these clear, structured plans, you'd think deaths from asthma would be something we'd consign to history, right? But a huge landmark report from the Royal College of Physicians revealed a really shocking and frankly heartbreaking truth. So back in 2014, they published this report, Why Asthma Still Kills. They dug deep into 195 asthma deaths, and what they found, it wasn't a failure of paramedics or emergency rooms. No, it was a failure of the simple day-to-day routine care. It was a massive wake-up call for the entire country. And get this was the headline finding, and it's absolutely devastating. In 46% of those deaths, we're talking almost half, the expert panel concluded that there were factors that could have prevented that death. Just let that sink in. Nearly half were preventable. So why? What was going wrong? Well, here's a huge piece of the puzzle. 23%. That's it. Only 23% of the people who died had what's called a personal asthma action plan. We're talking about a simple piece of paper, a document that's proven to help stop attacks from getting out of control. And here's the other part of this tragic story. 43%. That's how many of those who died had no record of an asthma review with their doctor in the entire year leading up to their death. Think about that. That's so many missed chances. missed chances to check if they were using their inhaler right, to tweak their medication, to spot those early warning signs before it was just too late. Look, these numbers are grim. There's no other way to say it. But there's a flip side. They also give us a crystal clear roadmap for how to prevent this from happening. The report's recommendations are all about empowering both patients and doctors to get in front of the problem, to take control long before an emergency even has a chance to start. So, what can you do? What should you take away from all this? It really boils down to this checklist. These 4 points come straight from the recommendations in that big report, and they are your keys to safer asthma management. And I really want you to look at number 2. Are you using more than 12 reliever inhalers in a year? That is a massive red flag. It's a huge sign that your asthma is not under control. So, if you answer no to the first question or a big yes to the second one, it is absolutely time to have an urgent chat with your doctor. Because that's what it comes down to, right? Preventing the worst from happening isn't just about the drama of an ambulance ride or the emergency room. Not at all. It's about the boring stuff. It's about that proactive, consistent, day in, day out partnership between you and your healthcare team. So we'll leave you with this question to think about. Is your asthma or the asthma of someone you care about as well controlled as you think it is? Because what all this data tells us is that for far too many people, the answer, sadly, is no. Thanks for joining us for this explainer.